The average American thinks that they'll spend about $75,000 on healthcare in retirement. The actual number for a 65-year-old couple that's retiring today is over $345,000. And that's before anybody needs any long-term care. The gap between what people expect to pay and what they really pay is one of the most expensive blind spots in retirement planning.
And welcome to Unlock Your Retirement. I'm your co-host, Tony Shore. And our host, the man with the plan, as you just heard, is Bruce Smith. Now, Bruce, great opening there. That is some scary stuff, though, those numbers, how much people will spend on healthcare in retirement, even with Medicare. And I think that's one of the biggest probably myths out there, or misconceptions or misunderstandings about healthcare and retirement, is that, well, I don't have to, healthcare is not going to cost me much because I'll have Medicare. Right. And that is just not true. You will have a lot of expense in medical. I mean, because Medicare alone, you still have premiums, you still have copays, you still have deductibles, you have it all. Still, Medicare doesn't wipe those out, and there's a lot it doesn't cover. So we'll get into some of that today. But Bruce, you've been doing this a long time. We've said it before on the show. You've been at this. You've helped people with retirement planning. You've helped people with financial planning, and you really do major investment planning, and you do it all. The retirement income planning aspect, saving people money, the tax forward planning, looking ahead. We've talked a lot about it on shows, and I know our listeners and viewers out there, Bruce, are going to have questions. You have a great team there. You'll answer questions for people. There's no obligation. There's no sales pitch. So listeners and viewers, if you want more information, all you have to do is go to the website, right? Bruce, tell them about the website, whywealthcare.com.
Yeah. So, boy, I don't know. I'm tired after hearing all that, Tony. My God.
Sorry.
So, well, I mean, we do a lot of things, but the biggest thing is that what we do is coordinated. I've talked to, our seminars just literally, we were just rocked with appointments. And, I've talked to so many people in the last couple of weeks, and they're like, Bruce, I have everything in place. Everything is good. And we have a discussion, and they're kind of like, well, I didn't think about it. Just talked to a guy this morning. And he's like, oh yeah, we got everything's good. Everything's in order. And it turns out he's leaving over $1 million in IRA money that's designated to go to his trust. And I went, whoa, 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 back the truck up. I said, you have beneficiaries. Let's make it go to your beneficiaries, not the trust, because you're going to trigger immediate taxation, a monster tax bill. And then his wife's like, well, why didn't anybody tell us that? Why didn't the attorney tell us that? Why didn't the financial guy tell us that? I said, because they don't provide tax advice. So, is about squeezing the most juice out of the orange. So number one, yes, we still do phone calls. We really are people, not AI. So 888-888-5601 works. But if you want to know more about us, go to whywealthcare.com. Why, the word why, W-H-Y, wealthcare with a K.com. And on there, we've got, I think there's 21 different videos that are less than 2 minutes. You have to put up with seeing me. Sorry.
But you look pretty good in those videos, Bruce. Seriously.
Well, I kind of explain, little pieces of what we do and how we do it. And that gives people the insight without having to get crazy or have to endure a 90-minute appointment or anything like that. And if any of that resonates with you, or if this show is resonating with you, pick up the phone and give us a call, or go to whywealthcare.com and schedule your 20-minute complimentary retirement value enhancement discussion. That's what we do. For what you're doing in retirement now, in that 20 minutes, it gives us a chance to listen more than we talk. Listen to you, listen to your situation, tell us what you're doing. We're going to ask you a few key questions. And from that, we're going to, as a minimum, we're going to give you the next opportunity, the next thing you should maybe be looking at, like in that case this morning. Hey, time out. You're doing something here that with the stroke of a pen, it'll probably make a $50,000 difference to your beneficiaries.
Yeah.
It costs you nothing to make that pen stroke, And so that's the name of the game. Give us a call, 888-888-5601. Yeah, let's have that 20-minute discovery call. Schedule it at ywealthcare.com.
Yeah. Well, and I mean, there are healthcare costs out there that people just don't talk about, like you alluded to at the top of the show. It's like, why didn't somebody tell me about this? Why didn't we plan for this? And you probably hear that a lot from people who you haven't been working with, but come to you after the fact and say, yikes, we didn't know we'd have to experience this. You've seen that, haven't you?
Well, the solution to healthcare is really, it's a four-letter word: hope. I hope we're going to be okay.
Mm.
Yes, we know we need. I mean, this is probably what's the word I want to use? This is probably the biggest. Not only is it the biggest unknown, it's the most common improperly received part of planning, because most people, it's really funny when people are looking to get a job. We were talking about my cousin the other day, and I remember 30 years ago, the guy is an amazing craftsman. I mean, the guy's phenomenal. I mean, you can't believe how good he is. And he's like, I'd like to start my own business and doing this. And I said, here, I'll help you. Here's how you do this. I'll structure it for you. I'll give you ideas. I even had a space. I said, set up your saws and everything. Do it there. And he's like, "Oh, I could never do that. I need health insurance." So, I'll accept a job for health insurance. And that's a big driver for employment. We have it our whole life. It comes out of our paycheck, or the employer's paying all of it or a portion of it, all of it if you're very lucky, and so we don't, again, it's out of sight, out of mind. It's just like taxes. So then in retirement, it's like, well, what's healthcare going to cost? Now, the prudent people are making sure it's in the conversation. It becomes a deal breaker, because people will go to other advisors and they'll come in and we'll say, okay, now we're going to budget this for healthcare to get you to Medicare, and then this is the budget that you're going to have, to get you through with Medicare. And that's where kind of the weird look comes in. Like, what are you talking about? I have a Medicare. I'll be good. It's like, no, Medicare isn't fully functional. Medicare has the donut hole. I love that one. Donuts are involved,
Yeah,
Tony. Got our attention, didn't it?
I'm alert. I'm aware.
Let's
Yeah,
woo.
anytime we can relate it to food, Bruce, I'll be there.
Donuts.
Donuts.
Don't you have one of those buttons you can push for Homer? But
I have a Homer button somewhere here, but
don't.
it's more it's not that. It's more he's talking about you.
Financial Panther, eh?
That's what everyone calls you, Bruce. Even Homer Simpson.
The Financial Panther. Well, I've been called
Yeah.
many things in my life. That was not
Well,
my name until today.
but over $300,000 for a couple spending on healthcare in retirement. Even Marge Simpson has something to say about that.
Well, I
Uh-oh.
just think we should be building a nest egg.
That nest egg is going to go away pretty quick, isn't it?
Yeah, I got him pushing buttons, ladies and gentlemen. I'm sorry. I apologize. My deepest sympathies. I'm sorry. I tried. I let it out of the bag. The Financial Panther. Oh, that's a new one. You got to get better buttons than that, man. Come on.
Oh no,
Yeah,
that's a good one. That's a good one.
let's scope this out. This is what amazes people. And at the root of this problem, at the root of this is life. Is how long we're going to live in retirement. And I don't think anybody purposely wants to live a short time in retirement. I mean, God, I've been doing this forever. And I remember, we used to look at statistics from back at early 1900, 1905. Do you know how long somebody lived? First of all, only a percentage ever made it to retirement.
Right.
And then if you lived in retirement, you lived a year, maybe two. So it wasn't like retirement planning was a big deal. And longevity has been a big deal. Today's trivia question for you, sir, is where did pensions come from?
Rome, ancient Rome. No, they had pensions for their soldiers. I heard that the pension
Well,
or an
that's
annuity
true.
was the early, like a different form, but the concept I've read actually started as early as ancient Rome, when they provided for something for soldiers or something. I don't know.
That's
I
true.
could be wrong on that.
But the big one was actually Otto von Bismarck of
Oh,
Germany.
yes. I have heard that in Germany. Yes.
Because what was happening was, the old people that had all the craftsmanship and all the knowledge and everything, they were working until the day they died. They didn't retire, and young people couldn't find slots to work. So they come up with the idea of a pension to, hey, let's get you out of the workforce, make room for the young people, and we'll let people move up. That's where pensions came from.
Yeah.
So, the great battleship, the Bismarck of
Huh.
Germany, Otto von Bismarck was our pension leader. So in the day.
Wow.
But,
Wow. So he was the first one to actually offer actual pensions. Yeah. That's
and
amazing.
that was the purpose, to kind of control the economic long-term picture of Germany. But the interesting part is, if you say, all right, let's say you have a supplemental cost of whatever for, my engineering friends love the word widgets. So you need a widget
Sure.
in retirement, whatever a widget may be, right?
Yeah.
And let's say it costs you $800 a month. Okay, well, what's $800 a month? That's $10,000 a year. Okay, times 30 years. So retire at 60, live to 90. That $800 a month doesn't sound like a big number, but 10,000 a year times 30 years is that $300,000 number we're talking about.
Yep.
So
Yeah.
when you build out a plan, you put in the budget for Medicare supplements. So basically, Medicare in and of itself is free, yes, but it has a lot of shortcomings. If you want to be covered the way you were with a good health plan, you don't want to be shocked and be paying for overages or uncovered expenses or what have you. You want to have, a thing that fills the donut hole, donuts, right? It covers that. And basically, I've got all these additional benefits that I had with my normal health care, but it is pricey. It's out there. So if you're not budgeting for it, then your plan has a giant hole in it you might want to be aware of, because that can be a way that you're running out of money because I'm paying for health care on the side. The second item is, it's probably the greatest motivator of people to come in and see us and say, hey, Bruce, I heard you talking about healthcare, and that's been a worry of mine for a long time. And you're the first one that's really kind of hitting the nail on the head and bringing it right to the forefront. It's like, yeah, it has to be accounted for. It's like, well, what can I do, if anything, in my planning to pay for that? And guess what? If we can find a way to beat Uncle Sam with a smarter tax strategy, maybe that's going to fund all your health care over your lifetime, and it's not going to impede on your lifestyle. So yeah, healthcare is expensive if you want good coverage, and that's still not covering long-term care. That's still, if you have a dementia.
No, we haven't even touched that
issue,
yet.
yeah, I mean, it's, we're living longer, and I've been saying this now for over a decade. God, everything's over a decade now. It's scary. I said they have built this incredible machine to relieve you of your wealth before you're in a hole in the ground. And they have. I mean, whether it's the long-term care approach, whether it's the retirement communities and the transition to skilled care, assisted care, what have you, all of this stuff has a pretty stiff price tag, and we need to understand that. And if it happens to both people, I mean, we've seen entire family wealth wiped out with this kind of stuff. But it starts with the basic coverages for healthcare, and then what is Medicare going to cost? We're going to talk about that on the show today.
Yeah. Well, and even before you reach Medicare age, because Bruce, as you well know, a lot of people are retiring before they hit 65, before they're eligible for Medicare. And those are the gap years, or the bridge years, right? Between when they quit their job, so they're no longer going to be able to get the group plan through their job. A lot of people don't realize their employer was paying 50% probably of that cost. So they're only paying half, plus they're on a large group policy, which means it's greatly reduced. So then when they have to pay for that on their own, it's a rude wake-up call. How do you make it between when you retire at 60 or 62? A lot of people are retiring at 62 to 65. They think, well, that's only 3 years. Yeah, thousands of dollars a month for healthcare insurance if you want good insurance.
Exactly correct. Or they have the COBRA for 13 months from their previous employer they left.
That's
and they
very
retired.
expensive.
And then you get the bill and you're like, whoa, wait a second, hold on a second here.
Yeah.
And it's one of the most the unkindest cut of all, is you can't run around unprotected.
No.
We had a client whose sister Um, I mean, she did the equivalent, I guess, of stubbing her toe. Okay, it happens, right? But it wasn't doctored properly. They did identify certain things after it happened, and she actually had, basically the toe died, if you will. So before it was totally a major problem, they had to go in and do this surgery, and the way she's telling it, and I haven't seen the paperwork on it, they're gonna bring it in, is the hospital bill for to repair her foot was somewhere north of 200 grand. But interestingly,
Whoa.
what wasn't covered by insurance is about 35 grand. So she's going back to the insurance company and, "Hey, wait a second, we need to relook at this." And that's a toe, I mean, we've
Ugh.
heard, so many things like that have occurred, so you can't be running around without this, but it's really a crazy way to financially wreck the rest of your life, so, yeah.
Yeah. Wow. Wow. And even once you hit 65, Bruce, there's standard Medicare costs. There are some costs to Medicare. It's not 100% free, right?
Correct.
Yeah.
Yeah. Yeah, and that one my own mother got bit on this one. She's like, "Oh, I don't pay anything for Medicare." And I
Oh.
went, "Okay, mom, that's great." She says, "No," she said, "I had" so she had an Aetna plan, which was basically it turned into a supplement as part of my
Mhm.
dad's pension,
Sure.
and I got rid of that Aetna plan. I'm like, "Okay, why?" And, "Oh, no, they brought me this plan, and I don't pay anything for it, and it's great, and it's marvelous." And the next thing was, "But that stupid Social Security, they cut my check this month. I don't understand why I'm getting less from Social Security." I'm like, "Mom, you're not getting less. It's what they're taking out for the insurance."
Mhm.
And, and that's the stuff that just burns me, is people
Yeah.
get sold and they take advantage of older people, which I
Yep.
have no time for, and I wish all their thumbs would fall off. But,
Yes.
yeah,
You
I
and me
mean,
both.
yeah, so what is that factor? Somebody needs to put a price tag on it, just like we put a price tag on taxes, a price tag on market losses. Let's put a price tag on that, and then say, look, where's it going to come from? You're not putting this on your credit card. Where's the money going to come from to make sure you have good health care, and in a way, kind of help protect and manage the risk to your portfolio of what a health event could cost you.
Yeah. Yeah, I cannot believe, all the ins and outs, and as people get older, you're more trusting and you're maybe not as cognitive as you were in your younger days or aware, and then people take
Speak
advantage of
speak
you,
for
and
yourself. Speak for yourself. I don't know what you're talking about.
yeah, I know,
What's your
but
name? What's
but
your
I
name?
see yeah, I see it with my parents, and I saw it with my grandparents, and now with my parents that, they were bright. I mean, my mom was, she was a CPA, did everything, and now she doesn't understand as much. I can't imagine without me helping her how they would figure out Medicare and Medigap supplements and without working with a specialist and working with a professional and having a financial professional like yourself. I just can't fathom all this because there's a lot. I've been trying to help them with their Medicare plans and they had an Advantage plan, but it went away because the company said it wasn't profitable for them anymore. So just they got a 2 months notice saying we're no longer going to offer this for you. And they'd been on it since for years and years. Had this since Advantage plans were offered. And so there's a lot of hoops to jump through. You have to redo it every year. You have to look at it. And I can't fathom how people can figure all this out. And they're constantly changing the rules, right? Every
Oh, no
year,
question about it.
yeah. Yeah.
Every year. Yeah, it's I mean, and I mean, you brought up a good point. So, yeah, Medigap, which is filling in the donut hole. It's the gap,
Yep.
that
Yep.
exists by, base Medicare versus covering all the bases. But
Yep.
then you have the prescription plan, and that's the one that
Part
like
D.
yeah, I mean, it's just the number of pills and things that we take, and one thing I caution a lot of our clients. I mean, I hear that one more than I care to admit is I have insurance, but they're not covering this particular med, or their doctor will recommend a certain version and there's no generic version. I mean, that's a show all on its own, as far as the prescription meds. But one thing you can do, and I encourage our listeners to do this, is if you're taking medication and you think it's costing you too much, go to, of all places, go to Amazon and put in the name of the medication, and you will find that they have special pricing on stuff. I mean, Amazon is the master of huge marketing, and they
Yeah.
cut deals with drug companies all the time. I have a relative that I saved them substantially on one of their meds by going to Amazon. Supposedly, Walmart pharmacies are kind of the same way. So, back to what we said last week on the show, the old Chester Karras, in life, you don't get what you deserve, you get what you negotiate. So don't just sit there and take that expensive medication. It's costing you a lot. Reach out, talk to the doctor. The doctor may have a special coupon, all of these things. This stuff is also critical because it's just money leaking out of your nest egg. And healthcare is one of the biggest hole is probably taxation, which we do a lot in that area of maximizing wealth by minimizing taxes. But the second one is obviously healthcare. And healthcare is trying to overtake taxes. I don't know. It's just like two evil fears that we should have, I think, with regard to retirement planning that we got to take care of.
Yeah. And you mentioned long-term care, but regular Medicare does not cover, you talked about needing Medigap or supplemental. Well, standard Medicare does not cover dental, vision, hearing, or long-term care. Well, the three things I
What's
know
that?
for sure.
What'd you say? What?
Exactly.
Hearing?
Most
What?
people,
What?
what? I get it. But those four things are the four things I'm pretty sure almost every senior at some point is going to need. I mean, those are the main things: hearing, vision, and dental. What goes when you hit your 50s, 60s, you notice these things start to have issues. Well, so Medicare doesn't cover those. What are seniors going to need the most? Let's find that and cross that off the list and not cover it. It's crazy, right? That you have to get a supplemental plan, but you need a Medigap or a supplemental or an Advantage plan that covers it, but you need to make sure it covers your dentist or your vision person or hearing person. And then, of course, there's long-term care. Both my parents are in long-term care. One is $7,800 a month. My mom is $11,000 a month. And that's not even top private. The private place that's, if she went to the top private place, it's about $13,000 for full-time, full nursing care, 24/7. So it is outrageous. And you can see how even the biggest nest eggs, people, well, I'll self-fund it. You will.
Yeah.
Are you going to leave anything to your kids? I guess you really do want that last check to bounce. So let's, take it seriously, right?
Yeah, I mean, understand it. That's the key is knowledge is power.
Yeah.
And you may not like what you're hearing, but you're going to know it's the truth. And then you say, here's how we're going to deal with it. So what is the problem? Let's identify, is there a problem? How costly is the problem? And how do we resolve the problem? And that's what elite wealth planning is all about.
Yeah. And you want to make sure your retirement plan and your wealth planning is going to, you have that in place, and it incorporates, okay, you're going to need some money for healthcare. You're going to need good healthcare coverage. That's a must. And so I think it's really important what we've discussed here today. Obviously, there's the non-financial side of healthcare. You want to be healthy going into retirement. You're going to spend less on healthcare the healthier you are. So that's kind of a no-brainer. That shouldn't come as a surprise to anyone. But we've covered a lot. We're out of time for our first segment, Bruce. I just noticed it. It flew by. It flew by. And we've got a whole new topic coming up in our next segment, and it's a good one. It's called The Cost of Doing Nothing. And that I'm interested to hear what you have to say about that. What's the cost of doing nothing? Doesn't cost me any money. That's how I save money, Bruce. So we'll get into that discussion argument here in a minute. But first, let's let our listeners know how they can get a hold of you. You've got all those great videos covering a wealth of knowledge and information and topics. How can they find you?
A wealth of information at Wealth Care. I like that. Yeah,
Yes.
so,
Pun intended.
Why wealth care? That's a good one. So why? WHY, asking a question. Why wealth care? Why wealthcare with a K.com. Go there. We have lots of great information for you. And then also give us a ring. Pick up the phone. Yes, as his coffee cup says right there. Yes, give us a call at
At this-
888-888-5601. 888-888-5601. We'll see if Rick Wakeman will answer the phone.
Yes, Rick Wakeman might, the greatest keyboard player in rock music history. And again, that website is whywealthcare.com, and it's easy, but that's care with a K instead of a C, and Y is spelled out, WHY, whywealthcare.com. And we'll be right back. All right.